Hey, this is Dr. Jenkins here at Active Health Chiropractic. So today I'm going to be showing you an actual treatment of myofascial release. Here in the office, the myofascial release technique that I use is called active release techniques, and it's shortened to ART. So we're going to be working on her shoulders because she's had really tight shoulders recently, and so I'm going to kind of show you what I do with the trapezius muscle, which is this muscle right here along the shoulders. And it also kind of goes down into the mid-back between the shoulder blades. As I push in, what you're going to do, Claire, is you're going to lean your head towards me to begin with. As I push down on my thumb, you're going to be bringing your head over to the opposite side. What that's going to do is that's going to stretch this muscle as I have it kind of pinned in place so that we can break up the adhesions. So go ahead and lean towards me, and now you're going to lean over to the right. So as she does this, I have hard placement right here on her shoulder, and that's just going to break up the muscle knot that has kind of built up in here. It's not the most fun treatment. It's kind of tender, but it usually gives immediate relief, so it's really nice. So we're going to do 3 passes. Kind of go over to the right again, and even though I tried to get your hair out of the way, I still have some. And we're going to do 1 more, and then over to the right. So this works the top of the trapezius, and the reason why this is so beneficial is because everyone gets really tight up in their shoulders, whether they're exercising or not. People carry their stress along the top of their shoulder right here so often, and so if you're working at the computer often, or if you cook in the kitchen a lot, if you're doing a lot of construction, there's a lot of different things that can cause all this pressure to be built up and tension. And so what this ART does is it releases it. So we're going to have you bring your arm up and just kind of let that arm relax. So now I'm going to work on the trapezius muscle down in between her shoulder blades. And so I'm just going to rotate this shoulder around just like that. We're going to hold just a little bit and bring it back, and then we're going to go around again. And one more time. And the reason that we hold at the very end is there's a fun little thing that 90% of the benefit of the stretch comes in the last 10%. And so once we get to the end of the stretch, we hold for just a minute or for just a few seconds in order to get the most benefit that we can. All right, so for this area, we're going to be working on the piriformis muscle. The reason that the piriformis muscle is important is because it lays directly on top of the sciatic nerve. And so when that muscle gets tight, it puts direct pressure on the sciatic nerve, causing sciatic pain, which is pain that can go all the way down the back of the leg, even down into the foot. Okay, so let's start with it neutral, and then go ahead and go forward with your leg. We're just going to bring it forward. Good. Okay, we're going to bring it back. Okay, we're going to do 2 more. Go ahead and go forward. Okay, bring it back, and 1 more time, forward. Okay, good. And so that's myofascial release on the piriformis muscle. So this type of treatment is really effective for people with sciatic pain, which is pain down the back. Oftentimes headaches can be relieved with the adjustment, and then doing active release technique on the muscles of the neck and the shoulders. People that have really bad shin splints can get help with the active release, and plantar fasciitis. I mean, there's so many types of conditions that can be treated effectively with myofascial release and the chiropractic adjustment. My name is Dr. Justin Jenkins here at Active Health Chiropractic, and we'd love to have you stop by.